A startling new study reveals the stark reality that many young black men in Chicago already know about gun violence in the communities they live in. Young men in Garfield Park are at higher risk of firearm-related deaths compared to what soldiers faced in combat zones in Iraq and Afghanistan, even in heavily engaged frontline units. Joining us now is Dr. Brandon Del Pozo, who conducted this study and is also an assistant professor of health services at Brown University. Dr. Del Pozo, thanks for being with us this morning. Appreciate it.
Yeah, thank you for having me.
So a lot of startling information in this study. Let's start with this. Really critically important is, what is the importance of drawing this comparison to war for young black men in Chicago? Why is that significant?
So if you read the news, right, folks have been calling Chicago Chirac for a while now. It's become a trope. And if we want to understand the magnitude of gun violence, my colleagues and I said, is Chicago in some neighborhoods really comparable to combat in Iraq? Every American understands the risks of war, and to see how the risks of living in Chicago compare in those neighborhoods would help really articulate how acute this crisis is.
And the crisis is deeply acute. What else did your study reveal? What are some of the other top-line headlines out of it?
Right. So we looked at military-age males, right, the age at which a male would typically join the military. And in the 10% most dangerous zip codes in Chicago, including Garfield Park, that was the highest, living at home was much riskier in terms of getting shot and killed than dying by any means in combat in Iraq and Afghanistan. That included in a frontline infantry combat brigade.
Wow, that gets your attention. Gun violence, of course, a public health crisis. What are some of the layers or ripple effects this has on young men, both mentally and physically? How do you walk through that?
Right. So each year in Garfield Park, there's about a 6% chance of a young male resident getting shot. But it's not just that victim, right? That's the obvious harm. It's also the loss that the survivors face. It's the PTSD, the trauma. When veterans come home from war and they face those risks, we're not surprised to see that they contend with a lot, right? Elevated risks of substance use, mental illness, homelessness, suicide. And that's from 1 year of exposure to a combat zone. These are risks that these young men face every single year, year after year. They accumulate, and you can see the PTSD developing in those communities.
You've also worked for over 2 decades as a police officer in New York City with the study. You see a similarity in Garfield Park now as you did in the most violent neighborhoods in New York in the 90s. Is that right?
Right. Well, I actually went on a ride-along in the 11th District with some great Chicago police officers a year or two ago, and my police career in the NYPD started in the 90s, and I'll say it felt the similarity was palpable. We look back in New York as the 90s as almost as basically as bad as it got, and just as a police officer, on patrol, I felt like a stark similarity just in what I was seeing out there.
You say that health equity requires prioritizing effective responses. What are some actions Chicago governmental bodies should be taking to reverse this? We have an election coming up in less than a week here in Chicago. What is the role of elected officials as it pertains to kind of what you learned?
Yeah, I mean, listen, as a former chief of police, New York City cop, but also as a health researcher, hewing to a party line or sticking with rhetoric is not going to get this done. It's got to be all hands. It's not either or. So there's just aggressive enforcement of the small group of people that are driving violence, really going after them with good law enforcement and policing, but then also community investment, right? Job opportunities, green space, community violence interruption. All those layers of prevention and enforcement can come together to reduce violent crime. That's what the evidence shows.
Well, thanks for laying out the evidence. It is eye-opening and alarming both. Dr. Brandon Del Pozo, assistant professor of health services at Brown University, joining us this morning. Thanks very much.